Fatty liver disease, known medically as hepatic steatosis, has emerged as a significant health concern affecting a substantial portion of the global population, particularly in developed countries like the United States. Understanding this condition, its causes, symptoms, diagnosis, treatment options, and prevention strategies is crucial for effectively managing and mitigating its impact on overall health. What is fatty liver disease? Fatty liver disease is characterized by the accumulation of excess fat in liver cells, leading to compromised liver function and potential health complications. There are two main types of fatty liver disease: non-alcoholic fatty liver disease, NAFLD, and alcoholic fatty liver disease, AFLD. NAFLD occurs in individuals who consume little to no alcohol and is often associated with metabolic syndrome, obesity, insulin resistance, and other metabolic disorders. AFLD, on the other hand, is caused by excessive alcohol consumption and is one of the leading causes of liver-related morbidity and mortality worldwide. Causes of fatty liver disease. 1. Unhealthy dietary habits. High consumption of foods and beverages rich in sugars, fructose, refined carbohydrates, and unhealthy fats can contribute to the development of fatty liver disease. 2. Insulin resistance. Insulin resistance, a condition in which cells fail to respond to insulin properly, leads to increased production and accumulation of triglycerides in the liver. 3. Obesity. Excess body weight, particularly abdominal obesity, is strongly associated with the development of fatty liver disease. 4. Alcohol consumption. Chronic alcohol abuse can lead to alcoholic fatty liver disease, characterized by the accumulation of fat in the liver due to excessive alcohol metabolism. 5. Genetic factors. Certain genetic predispositions and inherited metabolic disorders can increase the risk of developing fatty liver disease. Symptoms of fatty liver disease. Fatty liver disease is often asymptomatic in its early stages, with symptoms becoming more apparent as the condition progresses. Common symptoms and signs may include fatigue, abdominal discomfort or pain, particularly in the upper right quadrant, enlargement of the liver, hepatomegaly, elevated liver enzymes detected in blood tests, elevated levels of triglycerides and cholesterol in the blood, insulin resistance and type 2 diabetes, increased abdominal girth due to visceral fat accumulation. Diagnosis of fatty liver disease. Diagnosing fatty liver disease typically involves a combination of medical history assessment, physical examination, laboratory tests, imaging studies, and, in some cases, liver biopsy. Key diagnostic tests and procedures may include 1. Blood tests, liver function tests, LFTs, to assess liver enzyme levels, lipid profile, and markers of inflammation and liver damage. 2. Imaging studies, abdominal ultrasound, computed tomography, CT, or magnetic resonance imaging, MRI scans, to visualize the liver and assess for signs of fatty infiltration. 3. Transient elastography, FibroScan, a non-invasive procedure to measure liver stiffness, which can indicate the presence of fibrosis or cirrhosis. 4. Liver biopsy, a procedure to obtain a small sample of liver tissue for microscopic examination, allowing for the assessment of liver fat content, inflammation, and fibrosis. Treatment and management of fatty liver disease. The treatment and management of fatty liver disease aim to reduce liver fat accumulation, prevent disease progression, and address underlying risk factors. Key treatment strategies may include 1. Lifestyle modifications. Adopting a healthy lifestyle, including a balanced diet, regular exercise, weight management, smoking cessation, and limiting alcohol consumption. 2. Dietary changes. Following a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, while minimizing intake of sugars, refined carbohydrates, and processed foods. 3. Supplementation. Certain supplements and vitamins, such as choline, vitamin D, vitamin E, milk thistle, and omega-3 fatty acids, may support liver health and aid in the management of fatty liver disease. 4. Medications. In some cases, medications may be prescribed to manage underlying conditions such as insulin resistance, hyperlipidemia, and diabetes. 5. Regular monitoring. Regular follow-up visits with healthcare providers, including liver function tests and imaging studies, to monitor disease progression and treatment efficacy. Prevention of fatty liver disease. Preventing fatty liver disease involves adopting healthy lifestyle habits and minimizing risk factors. Key prevention strategies include 1. Maintaining a healthy weight. Achieving and maintaining a healthy body weight through a balanced diet and regular physical activity. 2. Limiting alcohol consumption, moderating alcohol intake, and avoiding excessive alcohol consumption to prevent alcoholic fatty liver disease. 3. Eating a balanced diet. Following a nutritious diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats while minimizing intake of sugars, refined carbohydrates, and processed foods. 4. Regular exercise. Engaging in regular physical activity, including aerobic exercise, strength training, and flexibility exercises to support overall health and liver function. 5. Avoiding smoking. Quitting smoking and avoiding exposure to tobacco smoke, which can contribute to liver damage and inflammation. Fatty liver disease is a prevalent and potentially serious condition that requires comprehensive understanding, early detection, and appropriate management strategies. By addressing underlying risk factors, adopting a healthy lifestyle, and seeking timely medical care, individuals can effectively manage fatty liver disease and reduce the risk of complications. Prevention is key, so prioritize liver health through healthy habits and regular medical checkups. Together, we can work towards a healthier future with optimal liver function for all.